Hello, my name is Madison Ward. Today I'm going to be comparing and contrasting Medicare and Medicaid between the two of each other, but also I'm going to show how Medicaid will differ between the states of Indiana and Illinois. First, we should go over just the basics of Medicare and Medicaid, and basically, it was an act that got enacted by Barack Obama in 2010, and the goal was to extend healthcare coverage to all Americans in order to be able to curb healthcare spending and costs, according to Ballotpedia. And it has, over the last couple of years, it has gone through a lot of legal challenges where people will try and challenge the constitutionality of the act because it obviously kind of upsets insurance industry since people aren't being forced to go to a third party insurance industry and rather they can get it supplemented by federal or state government. Um, but first, let's go over Medicare and Medicaid. I'm going to start off with Illinois. Medicare is going to be the same between the two states because Medicare is a federally administered healthcare service. So I'm going to still go over it between both states, but you'll see that they are the same. So for Medicare, obviously, like I said, it's administered by the federal government, whereas Medicaid is a joint federal and state service, but that is a state service. And then for Medicare, in order to be eligible, you need to be 65 or over. You can have a disability. Income is not a factor for Medicare, while Medicaid in Illinois is income or resource based, and there's other categorical requirements. So if you have children, whether it's one, or you would get more benefits under it if you had multiple. If you're pregnant, it also having a disability can fall under that category as well. For Medicare, the coverage focus is going to be more standardized health insurance. It's going to be about with getting to the hospital and covering those costs, any kind of medical costs really, and also like prescription drug costs. Whereas Medicaid is going to have more broad health and support services. This includes long-term care and wraparound services, which is usually something you don't see under being covered under Medicare. And then as for Medicare, people who get it can have to pay premiums, deductibles, or even coinsurance. It really just depends on like your eligibility and I guess the demographics they would have to apply with. And then as for Medicaid, it's usually often or low to no cost for covered services if you are fully eligible within Illinois. So the whole goal of this is to curb those prices. So a lot of times people will not have to pay for it, but it will be a low cost sometimes if you don't meet all of the eligibility requirements or like the state government doesn't feel that you have money to spare on that because they just do still need funding from somewhere for it. And then, so since Medicare is a federally supplemented service, it is on a national scope. And then as for Medicaid, it's a federal state partnership, but their scope is just the state since each state will have their own rules for having coverage under Medicaid. Now we can get to Indiana though, and you'll see how similar these two are. Once again, Medicare, federal government only, like we've already kind of reiterated. I won't go too much into detail under Medicare. For Medicaid, it's also joint and federal state. The Indiana FSSA is going to oversee that. It is a state service, though. Eligibility test, which we have already gone over for Medicare, is going to be 65 or older if you have a disability. Once again, income is not a factor for Medicare. As for Medicaid, though, income and categorical needs, very similar to Illinois, are going to be factors in determining what kind of benefits that you can get from Medicaid. So if you are low income, if you have one child or multiple children, if you're pregnant, if you're disabled, that also falls under that. The covered services within Medicare for Indiana is going to be your core hospital, prescription, any kind of medical coverages that you need. However, long-term care is going to be limited. Once again, in Indiana, we also have broader health benefits that Medicare does not cover, like that long-term care, the wraparound services that I kind of already mentioned before. And then the cost to individuals under Medicare, you can, like I said, you can pay premiums, deductibles, copays. There are several parts to Medicare that I didn't quite get into, but you have like Part A, B, C, D. Part A is often going to be premium free in Medicare if you're eligible for that, but usually for Parts B and D especially, you might have to pay those premiums and deductibles or copays under that. And Medicaid for Indiana, you're usually going to have no or low cost programs, or I guess copays, premiums, any of that. They have a lot of programs, or you can do cost sharing groups too, where that cost for your medical program is going to be dispersed among people, and it usually is pretty beneficial to people because not everybody will have a very big deductible or hospital bill that you need to pay. It's usually just like one person, so that cost will be dispersed among the people and everybody has to pay a small amount. As for Medicare, once again, that is a federal nationwide scope. It has the same rules in each state, so all of that is going to be the same between the Indiana and Illinois. As for Medicaid, that is also just its own state thing. While it is the federal and state partnership to get it, it's its own Indiana state's rules. Same thing how it was in Illinois. But after going through that, we can see that they're very similar between the rules, which I honestly didn't expect, considering that Illinois is a little bit more progressive than Indiana. I would assume that they would have broader benefits, I guess, while Indiana might have it as more restrictive. But it's a good thing that they're not. But Medicaid in both states is going to be that state-administered income-based program. They do have small differences between eligibility categories, what services they covered, and managed care arrangements. That's when you start getting into the smaller details about everything, though, about how caregivers and hospital providers are going to be giving their services to their patients. That's usually something that gets delegated within that category. They also, both states have something called dual eligible people, where you can be eligible for both Medicare and Medicaid. These are going to be delegated through the specific plans, though, and how each state will, I guess, like, see how you fit into each category. And also within Indiana's Medicaid, they have a lot of managed care pathways, I guess, that you can go through. We have the Hoosier Healthwise, the Healthy Indiana Plan, the Hoosier Care Connect. These are all just kind of support programs that I guess fall under like that healthcare category. There wasn't that many differences that I can see from them, other than like kind of how I mentioned that once you get into the specifics about how I guess caregivers are informed to provide care or services to patients. Other than that, the very large details are going to be the same between the two states, which I think is a really nice detail. Let me make sure I just didn't miss anything from the directions. Okay, yeah, basically that is it. In conclusion, like I have stated before, I'll just reiterate again, they are very, very similar. If I were to choose a different state to do it, I think I would try to do one that is more of a red state, I guess, or maybe even something just geographically different, maybe out in the West. I can see how those plans are going to differ between the two, because I actually would be pretty interested to do that. I just chose Illinois since it is right here, and I did expect to see a big difference, but I think that legislation between Indiana and Illinois and some of the other surrounding states gets pretty similar, so it isn't a total surprise to me. Overall, though, I think this is a great program, and the constitutional challenges that have been coming about it and going to the Supreme Court, they have withstood it so far, and I hope that I can continue to see that, because I think it is a great beneficial program to the people of America, especially those like who do actually fall under it, who are elderly or disabled, because if they were having to get third-party insurance and they're getting kind of screwed over, I guess, for lack of a better term, by these insurance premiums and everything, it's just not good. You're going to be losing so much money, and I think, yeah, overall, it's just a great way to disperse those healthcare costs, and while we can't have universal healthcare, I think this is a great step in the right direction. Thank you.